7.5, we'll go red
Yeah.
and no.
Go red at 7.5.
Yeah.
And I'll turn it off at 8.
Then off at 8.
Yeah. Chair, fellow speakers. So I chose this particular topic because personally I find it quite fascinating how there has been significant improvement in life expectancy, not just in the UK but globally in recent times. I think this is a testament to the progress we've experienced as humans in various fields that has led to humans living longer and healthier over time. So I looked into this research by Professor Neil Cummins of the London School of Economics. So he was studying the lives of nobles in England and Wales between the 1400s to 1900s. And what he found was quite fascinating, that between 800 AD to 1400 AD, the life expectancy of the noble was just 48 years back then. And these nobles, they had I would say the better life. So they had the money, they had access to better health facilities and sanitary conditions, and the life expectancy was just 48. And then from the 15th century to the 17th century, the life expectancy for the nobles was 54. And by the 17th to the 19th century, it was just 56. So back then, the local population would have had a lot less in terms of the average life expectancy compared to what the nobles had. And if we move just closer to the 1950s in the UK, the life expectancy was 69 years, which was 5 years after the Second World War. And then in the 1960s, it's increased to 71, 1980, 73. So there was this gradual increase of 0.3%, 0.35% through every 10 years. And then in 2000, the life expectancy was 78 years. And then now, 2024, the current life expectancy is 82 years. So it's actually 81.92 rounded to 82 years. So the life expectancy in the UK compared to the rest of the civilized world, I would say mostly developed countries, is still relatively low. So in Japan, they have a life expectancy of 85 years. In Switzerland, 84, Italy, 84, and then France, just next door, is 83 years. That's the average life expectancy. So what I wanted to really look at was what has led to this increase over time from the, say, 1950s, where we've had steady growth in life expectancy. What are those factors that have influenced? And one of them is advances in healthcare. So over time, we've had medical breakthroughs, we've had advanced treatments with the NHS. That's something I'm sure they didn't have maybe in the 1800s. And also people having easier access to health facilities. So when someone is, say, in an emergency, you could call the ambulance. And then also having vaccination programs like we had during COVID. In recent past, measles, cholera, these were life-threatening diseases. Someone with cholera, it's a death sentence. Malaria, still in some places in Africa, is still a death sentence. But in the developed world, we've had improved medicine to combat such ailments. Another factor is disease prevention and control. So having public health initiatives that has helped to control diseases, also having proven strategies to ensure that diseases are curtailed has also really helped in improving the life expectancy levels. Viruses like HIV/AIDS, which otherwise didn't have treatments, say 30 years ago, currently now you have drugs that people with HIV can live normal, healthy lives just like every other person. So also tuberculosis, now vaccination for tuberculosis has also helped to improve life. The third factor that is said responsible is technological innovations. So having wearable health devices. Now from your home, you could take your blood pressure on your own, take your pulse, your heartbeat, your breathing. So there's been massive improvements in technological advancement that has really helped, especially in improving the health of people being able to, so just also advancement in terms of detection of health issues. So being able to detect a disease in the early stages, that is something that's really helped to prevent people dying from diseases and ailments. And the fourth factor is improvement in nutrition and sanitation. So over time, we've learned to eat healthy. So there's also been improvement in the diets of people. Otherwise, where you have in the past where people focus only on eating potatoes and not having balanced diet, now we have awareness where you're able to eat and you know whatever you're eating has to contain little portion of everything to give you carbohydrate, protein, and vitamins. Also, access to clean water, proper sanitation. Say in the 1800s, people didn't have proper toilets or sanitation in the homes, but now all of that has been improved, and that has really helped as well. Another factor is lifestyle changes. So the fifth factor, lifestyle changes. Having increased awareness on the importance of healthy living. So this also relates back to what we've just said on diets. So eating healthy, also exercising. So doing activities daily, stress management, you have emotional also control with going to therapists. So all of this has helped to improve the lifestyle of people, which has also had an effect on the life expectancy in the long run. So there's also campaigns that has also helped lifestyles, like people campaigning about the harmful effects of alcohol or excessive smoking. So such campaigns have also helped to kind of limit, for those who smoke, the number of cigarettes you smoke a day, or switching from cigarettes to vaping. All of these have really helped in improving the life expectancy. So overall, what is really the increased life expectancy, the factors that have helped, it's a combination of these factors. It's a multifaceted approach. It's not just one thing that has improved life expectancy since the 1950s. So although there has been an increase in life expectancy, but currently in the last 5 years it has plateaued. So there has been just a flat line in life expectancy. So from the previously 0.3% every decade, it has declined to about 0.1%. But the United Nations still projects that by the 2100, that life expectancy would increase to well over 90. And some of the factors that they are attributing would be maybe the involvement of artificial intelligence in human and so in humanity. So people being able to, like the Neuralink with Elon Musk, so being able to fuse human intelligence with AI, they are thinking that would improve. I don't know how. I didn't do much research into it to see how that would improve human life expectancy, but that's something that the United Nations are projecting would have an effect. So yes, so it's a fascinating story, and I'm happy that I could share with you. Thank you.